So, welcome to I don't know if you can see me because we are starting already, and we are looking at tap live stream, connect upper and lower limb. So the thorax, abdomen, and perineum is a connection, okay, between the upper and the lower limb. That's a very powerful. In fact, if you understand that statement, you understand upper and lower limb. That statement is what I'm trying to lay a foundation. Okay, so if we were to fix anatomy, it would have been good we start studying from the inside out. It would have been good we start studying from the thorax, abdomen, pelvis, and perineum. So the idea of this upper and lower limb coming before tap, it's not really nice. Okay. I wish I were to have an influence. I wish I were to start a curriculum of say thorax, abdomen, pelvis, and perineum should come, okay, should come where? Should come before upper and lower limb, because that is the origin. That's where it all begins from. That's where it all starts. Okay. And okay, as we talk about upper and lower limb, we said, okay, that the upper limb and the lower limb, okay, are on the superior and inferior part of the tap. And that's not what we want to do. What we want to do is to make sure that we finish tap, then we can go to upper and lower limb. Okay, because whatever you are seeing in the upper limb or in the lower limb originated from the tap. Yes, think of whatever structure you can think of. Before the limbs grow out, where did they come from? Before the nerves that supply it, where did they come from? Okay, before the blood supply, the arteries that supply, where did they come from? Think of the muscles that are there. Many of them have origin from this thorax. And then the other ones are extensions. So that's why we want once again to finish the thorax we had. Okay, I started. And I'm grateful to subscribers and the comments in the comment section who are making beautiful comments. I'm going to show you one. I'm going to show you one. Okay. Now look at this. This is wonderful. I do not know this person. I don't know if this person knows me, but of course, if you have seen my face, you may know me as one thing or the other, of one person or the other who has been an assistance to him or the other. Okay. So now, what we are talking about now is talking about anatomy. Okay, we're talking about anatomy of the thorax, anatomy of the abdomen, anatomy of the pelvis, and anatomy of the perineum. Okay, remember we had said perineum is different from peritoneum. Okay, so we are diving in to finish what we started in thorax. We said the first 6 things or first 7 things in thorax is Jack Sifim. Jack Sifim. Okay, that's Jack Sifim. Hello, Jack Sifim. What does that mean? JEC hyphen, another C hyphen FIM. That stands for joint of the thorax, extent of the thorax, composition of the thorax, characteristics of the thorax, function of the thorax, inlet of the thorax, and meaning of the thorax. The meaning of the thorax, we said, it stands for what? Introduction, Iran. Okay, meaning is the region between abdomen and neck. That's the thorax. Okay, we showed it in the video before now. And then moving away from there, we talked about the what? We talk about what? How do you call that now? The inlet of the thorax. We say talk about the inlet of the thorax. We say V square man. All right. V square stands for, the first V is for viscera, next V is for vein, M is for muscle, A is for artery, N is for nerve. For the nerves, we say PVSL. That is phrenic nerve, vagus nerve, sympathetic trunk nerve, and the left recurrent intercostal laryngeal nerve, left recurrent intercostal laryngeal nerve. Then we talk about the artery. Artery and vein, okay, are easy to know. Okay, not that others are not easy if you are endeavoring, if you are showing a level of effort. So what does that mean? The E there, which is the A there, which is artery. You said the mnemonics for the arteries is BSC. BSC. Please don't mistake this with the blood supplying arteries to the thorax. These are just the arterial vessels, okay, that passes through the thoracic inlet. Okay, so BSC stands for what? Brachiocephalic artery, and then S stands for left subclavian artery, and then C stands for left vein. So there's BSC in vein and there's BSC in artery. Can you imagine that? There's BSC in vein and there's BSC Okay, so I'm back here again. I needed to go get light. Okay, so this is wonderful now. Okay, it's amazing. So I was showing you that someone make this comment in the comment section, and for me it is actually encouraging. For me it's actually encouraging to find that someone make this kind of comments. I think is this one is okay, so we need to work on it. At, so moving away from here, we want to look at what are we look at the thoracic wall. In the morning and the day before, we have looked at thoracic thoracic joint and thoracic inlet. That was yesterday. And later this morning, that was yesterday night. And later this morning, we have looked at, we said that very tall rats, very tall rats, okay, very tall rabbits, okay, travel very bright street, okay, to avoid cars, okay, very tall rabbits travel very bright street to avoid cars. And what we said that stands for was that the very tall rabbit travel very bright street to avoid cars. The very here stands for vertebral levels. Vertebral levels. The T here stands for thoracic outlet. The R here stands for relations. The TR stands for thoracic cavity. V stands for venous drainage. B stands for blood supply. S stands for spaces, that's intercostal spaces. Okay, that's the vein, the vessels there. Okay, and then thoracic, this stands for thoracic wall. Thoracic wall, the other one was thoracic cavity. Then A stands for what? The action. Okay, action of the joints and muscles in this thorax. Okay, or the action, the function too of the thorax. Okay, and then we talk about the clinical significance. Those were the 10 things we consider. Now, but 5 of them was considered in the 2 hours, and that was the vertebral levels, that was the thoracic outlet, that was the relations of the inlet. Okay, that was the venous drainage, that was the blood supply, that was the 5 things we considered. So the next 5 things that is remaining include this, the clinicals, the action, thoracic wall, thoracic space, thoracic cavity. So we have done venous drainage on this, on this, on this, on this. Okay. And don't forget, we say Jake C film, that's J, okay, and then what do we have? The next one is E, C, and then C, and then F, I, N. Those are the things we considered. And then we say for the joint, we have C6 SMS. C6 SMS. And then for the interthoracic, the inlet of thorax, or thoracic inlet is a V Spearman. Okay, the V there for viscera is the rotator. That's the remains of thymus, the apices of lungs and pleura, the trachea and the esophagus. Okay, the extent is the SIP, superior mediastinum, where you have the mass, manibrum, arc of the aorta, and the sternal angle of Lewis. And then what else do you find there is the next new thing we want to do now. STP, that's for the composition, sternum, thoracic vertebra, and the ribs. Moving away from there, we said the characteristics SMSTTD. Then moving away from there, we now said, what do we say? We said SMSTTD, skin, that's epithelium, superficial fascia and deep fascia, that's the connective tissue, muscle, that's the muscle tissue, thoracic cage and thoracic wall, that's where you find neurovascular bundle and intercostal and clinical scenery. Alright, so we're moving on. Let me take some water. Yawning tells you need water. Okay. So we are here again. Okay, so we have some water here, and then moving away from there, and then we said we want to look at these things. So in the morning, the vertebral levels we saw were just 3 vertebral levels, and that corresponds with the superior mediastinum. Okay, we see mass, and then the inferior, anterior, middle, and posterior mediastinum, it correspond with MD hex. MD hex. Then we talk about the thorax. We said thorax, okay, CRL TM deals. Control traditional marriage deals. That was the thing we talked about. Okay, so moving away from there, we said the C there stands for, the C they stand for cruise, the right and left cruise, and the R here stands for the ribs, okay, the ribs, and then the L here stands for the lateral arcuate ligament, and the T there stands for what? Then the M there stands for the median arcuate ligament, and the medial arcuate ligament. Okay, then moving away from there, and what was this one? Thoracic outlet. Thoracic outlet. The D is the heart. Okay. So the D is the diaphragm. Okay, said CRLTMD. C there stands for cruise, left and right cruise, and then R stands for ribs, and then L stands for lateral arcuate ligament, and then T stands for thoracic vertebra, 12 thoracic vertebra. Okay, and the what stands for? The M stands for May. The M there stands for TM. Okay, middle arcuate ligament and median arcuate ligament and medial arcuate ligament. The D is for diaphragm, E for epigastric fossa, then A is for abdominal hiatus, L is for lumbar, the L for ligaments. Okay, so now let's speak. What else do we look at? Relation. We say Paul, P for posterior. Okay, relations where you have the T, posterior relation where you have the what, the last TU. Okay, and then you have the T1, superior surface of the T1. That's what we said. The A, we have medial mandibular sternal joint, the anterior mandibular sternal joint, and then the neck ones have the U and L, usually H and H, when we get from material to study. Okay, moving away from there, we said the U there, that is the upper part, P is the posterior part, A is the anterior part, U is the upper part, L is the lower part. So the lateral part rather, the lateral part continues as ribs, and then the upper part continues as the MSG, mandibular sternal joint. Okay. Moving away from there, okay, we will stop by a very short while and then go for a break and come back for this again. Okay. So we move from relations, which is Paul, to teacher. Okay. A thoracic cavity. No, we didn't do thoracic cavity. We did venous drainage or venous routing. We said that the ascending lumbar artery, drains into the subcostal inferior vena cava. Okay, there's a drain that flows into the subcostal. So after that, we said that how do you call it now? What are we even looking at? Venous, yeah, from the ascending lumbar vein to the arterial ascending lumbar vein, ascending lumbar vein. From the ascending lumbar vein, the next thing is it drains into the subcostal vein. From the subcostal vein, it drains into the accessory hemiazygous vein. And we say as. Like we say as. Okay, as. That's what we said. And then later from there, we now said that stands for all those ascending aorta, and then subcostal, and then after subcostal, we'll talk about empties into the hemizygous. Next, we have the other one that is common, which is accessory hemiazygous, and the last one is hemiazygous. So let's move on. When you look at this concept, you see that we have talked about the venous, the blood supply, CID, SCID. The S stands for supreme, okay, intercostal artery. The C stands for costocephalic artery, okay, costocervical artery. This stands for deep cervical artery. So I know if the injury, okay, sorry about that. So we move on. Okay, just a little bit tired, so we're going to take a little break and then we continue. Okay, I've been after the morning session. Actually, I had another session. Okay, from I think around 11. Okay, morning session. I had to move to study in another session from there till 2:30. Okay, was it 2:30 around 2 or so? Yeah, exactly 2. That's when I finish, studying and sharing. From there I have to move to another place. Now I'm here, okay, trying to change different study sessions. So it's not really easy. So sorry about a little bit dosing on that camera. A human being. So let me take my water again. Now normally what happens when you are dosing, because it's normal. Now let's learn this now. Okay, what you do? You take your medicated water, okay, take your medicated water, or you take water like this and let it touch, okay, your cervical plexus posteriorly. Okay, so when you move from there, the next thing you talked about, okay, as you move from there, the next thing you talked about is, what did we even talk about? Let's see the next thing we talked about. Okay, so well, we've talked about relations, up superiorly or upper. Okay, we said you have continuation, okay, with the neck, continues with the neck. Then posteriorly it continues with the superior, uh, upper superior T1. Posteriorly you have upper surface of the T1, and then anteriorly you have the manibrum sternum joint, okay, and then that's about the thorax. And then talking about the um, upper continues with the neck, lower is where lateral is where you have the ribs. Okay, so we are still building on that. So vertebral vessels is defined as a vertebra name given to each of the vertebra. Thoracic vertebra, okay, the thoracic vertebra divided into 3, okay, using the mediastinum, okay, very serious line for identification. So we have T1 to T12, okay, T1 to T4, you know what it is, T1 to T4, what are they? You have the superior mediastinum, then T4 to T12, you have the inferior mediastinum, the superior inferior mediastinum there, and posterior mediastinum. Okay, so still tired, so if you're not really getting this session, no problem. I don't expect much from this session, okay, because I've been a little bit worn out. So I'm going to end this session by 4:30 and go to rest. I'm going to end this session by 4:30. We've not really connected upper and lower limb, so but once I'm active, once I wake up from rest, we'll continue the sessions from there, okay, so that we can have the best. Is that okay now? Yeah. So I'm only doing review of what we've done, and then plus up I've told you, and then what else is we did was the loss of the video space is not thoracic cavity, no. Okay, so that's just what we did. Okay, I've recapped it. So when I'm back again, we'll do the internalization of the remaining life subtopics. All right, thank you very much.